Good evening. My name is Martin Luther Nugu Wake Up. I'm a student practical nurse. This video is about transdermal medication administration. For this, we're using bed rotation number one. I will start with my medication check. So I have my transdermal patch here. So I have the doctor's order here and the medical administration record here that needs to be filled as soon as we administer the medication to our patient. So I'm going to check first the doctor order against the medical administration record. So the name is Smith John, date of birth October 21st, 1981. Smith John, date of birth October 21st, 1981. So the medication to administer is a transdermal patch. So it's transderm nitro patch 0.4 milligram daily at 0.800 and at 20 and at 2000 or 2000. So over here, uh, apply transderm nitro 0.4 milligram patch daily. So and remove the patch at two, at 2000. So yeah, after checking my the doctor's order against the medication and against the MA, I can put the doctor's order away. I'm just gonna go by the MA now, and I will check the MA with my transdermal nitro now. So I'll do the first check. Transderm nitro 0.4 milligram, transmed nitro patch 0.4 milligram patch daily. um the time is 0800. Date is January 17, 2021. So it's matching with what we're being asked over here to administer to our client. So now I'm gonna check the five rights. So the right patient is Smith John, October 21st, 1981. Smith John, October 21st, 1981. The right medication is Transderm Nitro patch 0.4 milligram. Transderm Nitro patch 0.4 milligram. The right time, it's daily. The right route, it's a transdermal. So the right dose is 0.4 milligram. And then I will check the expiry date. So the expiry date here, it's January 31st, 2022. So that's the completion of my first check. The second check I'll put in my palm here just to make sure again the right patient. It's Smith John, October 21st, 1981. Smith John, October 31st, 1981. The right medication is the transdermal nitro patch 0.4 milligram. Transdermal nitro patch 0.4 milligram. The right time is daily. The right dose is 0.4 milligram, 0.4 milligram daily. The right the right dose is 0.4 milligram, as we mentioned. The right time is daily, and then the right route is transdermal. So that's the completion of my second check. The third check, I'll put that in the plate that I'm taking to my patient, and I'll check again. So the right patient is Smith John, October 21st, 1981. Smith John, October 21st, 1981. The right medication is it's a transderm nitro patch. The right route is transdermal medication. Transdermal. It says here the right dose is 0.4 milligram. 0.4 milligram. The right dose. The right time, it's 0800 right here. And the expiry date, it's not written on my MA, it's written on the patch itself. So that's the third uh, check complete. So now I'm gonna go administer the uh, the transdermal patch to administer the medication to my client now. Now I'm coming to see my patient. Uh, I will start with some hygiene, practice hygiene first. Come, come, come. How are you today? My name is Martin, and I'm gonna be administering some medication to you. It will be the transdermal medication. What's your name, please?
Smith John,
And what's your date of birth?
October 21st, 1981.
I'll check with the two identifier. That's good. It's matching. So do you have any allergy?
No,
And prior to that, your vital sign were within the normal range, but according to the what I could see here is your oxygen level was slightly slow, and you had difficulties climbing the stairs and all that, had a shortness of breath when you were climbing that. That's why we're going to administer the nitro, so that before any exercises you will be able to climb the stair without too much difficulties. That will help you to breathe better, and your heart will be working better. So it will relax the vessels of your heart, and your heart will work in better conditions. Do you have any allergy, please?
no.
Any pain?
Mhm.
No. Okay. Um, so I explained to you the reason for medication, and sometimes it can sometimes give you some side effect, like lightheaded, a little bit of dizziness, lightheadedness. In this case, I really advise you, after you've taken that, to rise slowly, not just jump from a sitting position or from a lying position too. That's important. And of course, you know that you have the right to refuse the medication. What I will proceed, and I will. Did you had the old patch? The old patch is still there. I will just take a look. I will administer that right here, but I have to make sure the this the spot is it's really clean before we can. I have some clean cloth here that I will clean first before administering that. Um, right there. So, um, do you take any other patches, any other medication? No. Okay. So that's good. I'm gonna just administer that to you, and yeah, administer the patch. More. Put that there. Make sure. So the patch, we will remove that at 8 o'clock in the evening, which is 2000. So um, we we will probably put that on a different size or side after that. Something that we will do, well, I would, now that I have administered the patch to my patient, I'm gonna put away all the and put in the trash, or dispose all the rest of the stuff that I had, and I will write the medication. I will write I will complete. I will I will complete the documentation. So by signing right in front of where it says on the MAR, transderm nitro patch 0.4 milligram, I will just write my initial and the date. So I'll complete the MA as I mentioned, and it should be the administration of the documentation should be 30 minutes within the time. So for example, it's calling for 8 o'clock, so I could do somewhere between 7:30 and 8:30, and I will do the right evaluation. So one of the things that will be important is first when I looked at the bed rotation after taking all the medication, it mentioned here that my client uh, had an oxygen saturation at 94% compared to 89% just before he took the medication. But this is after all the treatment. But I would assume that the nitro did help uh, my patient, and I can also see that the breathing now, the respiration rate, it's on labor. Before that it was labor at 22. Now it's within the normal range between 12 and 20. So yeah, this concludes the presentation video regarding the transdermal patch. Thank you.